Hi, I'm Cynthia Geocaris, and I'm here to talk to you about robotic surgery. And I put up a picture of the robot on my computer so I could talk to you all a little bit about what the robot looks like, what robotic surgery is, and what it means for you. So here on my screen is a picture of a surgeon sitting at a robotic console. This is the Da Vinci SI console. We now have an updated console called the XI, but it looks the same. And the surgeon sits and actually controls the instrument from this console and looking into this screen. His hands are in little hand holders which control the instruments, and some of it moving the camera, and some of the instrumentation is controlled by these series of foot pedals on his feet. Over here is the operating room table and an imaginary patient with the operating room assistant who will actually help put the instruments in and out for the surgeon. This screen is the same as what the surgeon looks at, which is a monitor screen of what's going on during the surgery. The instruments go through here. There's a camera in the center, and the surgeon actually has 3 instruments that he can control. They are as small as 5 millimeters inside on the inside. And I'm gonna do a little motion with my hand, and what's unique about them is that they have a wrist that moves just like your wrist and open and closes like your hand. In traditional laparoscopy, our instruments are about 5 to 8 millimeters in size, but they only open and close like this, and they only move like this, like your entire arm. So they don't have the spatial plane of movement or the ability to get into small spaces or tight angles in the abdomen. So why is this important for you, and why would you want to have robotic surgery? So first of all, I'll talk a little bit about the surgeon. It's better for the surgeon. So it's easier on me. I get to sit at a console. It doesn't hurt my back. It doesn't hurt my neck. And I'm much more relaxed when I'm able to sit down in a relaxed position and do surgery that way. Second, I get 3D visualization when I'm working through the robotic camera, as opposed to 2-dimensional visualization when I'm working with traditional laparoscopic cameras and instruments. So I can see depth perception and do more accurate surgery. So for you, why is it better for you? Well, we get to do surgery through small incisions with less pain, less bleeding, and a faster recovery for you. We can do more complex surgeries than traditional laparoscopy. So we can do very complicated surgeries that would traditionally be done with a big incision through smaller incisions. When we do them through smaller incisions, that means patients get out of the hospital faster. So this has been a big game changer in general surgery, especially in the world of hernia repairs and bowel surgery, where people were staying in the hospital up to a week or even longer are now in the hospital for just one day or even just a few days. So in short, those are the advantages of robotic surgery. I hope you learned something today. Remember, here in my practice, we have 8 surgeons that do robotic surgery, and wherever you're going to choose your medical care, I think it's very important you ask if this is a technology that is applicable to you and your situation.